Today's date is October 10th, 2019. We're here with Nellie and her mother, and I have permission to video you.
Yes.
And the purpose is to post this, and we're going to try and help you. Is that okay with you?
Yes.
Thank you. Nellie is 19 years old, and you're here with several issues. One is you have pain in your back around this area here,
Yes.
and that started not long after a DPT shot at age
MMR.
an NMR shot in your teens, and also it started after you had some root canals done. Now you're awfully young to have all this dental work,
Yes.
but you have a lot of root canals, right?
Yes.
Okay. Ellie also has polycystic ovaries diagnosed, but that seems to be getting better. She has cleaned up her diet, and after eliminating gluten and dairy, you've been losing weight, and your periods now, instead of coming every 6 months, are coming every month.
Mm-hmm.
That's absolutely fantastic.
Yeah.
You also have some issues allegedly with ADD, and your mom wisely tried to keep you from getting vaccinated, but you did get some vaccines, and then you got some more vaccines in your teens, and then your health deteriorated significantly after that.
Yes.
Because after a couple vaccines, Mom, which ones were they?
MMR, Hep B.
Hep B, and I can have you in this video as well?
Absolutely.
Thank you. You got bruising here out of the blue,
Bruising here.
okay, out of the blue, and show me where?
Right here.
Along your breasts.
Yeah.
Oh, wow. And you also got sciatica afterwards,
Yeah.
correct? Okay. And the doctors told you to go see a shrink.
Yes. Painkillers. They gave her really heavy duty painkillers.
They gave her NSAID drugs, painkillers,
Norco, Toradol.
Norco, Toradol. They give you all kinds of
Vicodin.
drugs. And Vicodin.
Yeah.
Unbelievable. Norco, Toradol, Vicodin. This is
Yeah.
for your back pain,
Yeah.
right? So they made a drug addict out of you, or they tried to. And then you also got recurrent strep throats requiring repeated rounds of penicillin, correct? Okay. And this is after vaccines and the other stuff.
Yes.
All right. And we know this is also interesting. Your mom was an excellent mom. She fed you well. You didn't
Yeah.
start eating trash until you went to high school.
Yeah.
All right. So it wasn't on your mom's watch that this happened. This seemed to happen after the vaccines. And yes, you had problems with your teeth. Granted
Yes.
that. We don't know why.
Yes.
Could be familial. We're just going to do a test before I do anything with you. And we haven't done anything yet. I'm going to bring this leg out. Is it running?
Mm-hmm.
Okay, and I'm going to ask you to hold. Hold, 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 hold. There's no strength there, right? And you can get her face too to show that she's absolutely got no strength, and I don't have to put much pressure on that leg. Now this one, we're going to hold it out like this. Drop your leg in my hand, and I'm going to say hold, hold. I think that's pretty clear that there's a difference.
Yeah.
And you don't think I'm faking this, do you? And I think you could easily see, hold. I'm putting a lot of pressure on, and with this leg, I can take my one finger, hold, and bring it back in. So there's a real significant issue there. And the other place that we can see a problem is, Mom, you can go over there. I can raise this leg very easily. Straight leg raising is quite nice there. It goes beyond 90 degrees. And this leg, oops, you're jerking, right? You didn't like that. And we're not even at 90 degrees. So we see a significant difference. Okay, Mom, you can turn it up. It's not just general muscle weakness. It was an isolated. We're going to check your psoas muscle. Hold. And so I just tried to push out that way, and you're nice and strong.
Yeah.
We're going to go out this way. Hold. It's nice and strong. Okay, Mom, you can stop. Now, the only thing we've done so far, right now, is we just put a little local anesthetic in tooth number 12, correct?
Yeah.
We've done nothing more than that, right?
Yeah.
And there's a few tears in your eye because you were afraid, but it wasn't so bad, was it?
Yeah.
Okay. And Mom, you'll attest that's all we did, correct?
That's it.
All right, so I want to see if there's any change in your leg muscles. So I'm going to bring this leg out like this, And I'm going to say hold, and we're going to bring it to the middle. Hold. What do you think about that?
It's crazy.
What'd you say, crazy?
Yeah.
You surprised?
Yeah.
All right, let's try it again. Hold.
Doesn't
Mom,
look
what do you
very-
think?
I just want to know how we can find a solution based on that
All
information.
right, that was interesting, wasn't it?
It doesn't hurt as much.
Now,
either.
and it doesn't hurt, and I didn't tell, you volunteered that, right? Okay, so let's bring this leg up. Keep it straight, keep it straight, keep it straight, keep it straight. What do you think, honey?
It feels like the other one.
Yeah.
Right, look how far we got,
Yeah.
right? You're past 90 degrees,
Yeah.
okay? You're past 90 degrees, okay? Just doing that tooth, look what that's done for you so far,
Yeah.
okay? Now you know what I want. Look at that.
Yeah.
You were in pain when I did that before, okay?
Yeah.
Why don't you hop up and tell me what you notice about the pain in your back, because that's one of the big reasons why you're here.
I don't feel anything right now.
You don't feel anything right now?
No.
All right, if you came in here with 10 points on a scale of 10 of pain, I'm not saying it was a 10 when you walked in, but we're just going to grade it a 10, and 0 is no pain, and you walked in the door with 10 points, would you, is it a 0? Is it 50% better, or a 5? What would you tell me?
It's 75% better.
75% better. That's what I needed to hear. And that's the only thing we did was we numbed this up here.
Yeah.
Okay, would you have believed that if it didn't happen to you?
No.
Okay. And I don't think you would have either, right, Mom?
No.
All right, shut it off. This is very interesting because that pain went down by 75%, maybe even more.
Mm-hmm.
But I don't want to put that in your mind. You're the one who volunteered the pain got better.
Yeah.
And you also noticed that your muscle strength got instantly better.
Yeah.
Isn't that amazing? You had weak muscles there. So that tooth is in the meridian of the lung large intestine, and the lung large intestine meridian runs L4, 5, S1 area in your low back. So that tooth is probably infected, in my opinion, and is poisoning your system. It could be spewing infection out, as root canals do, and it's, in my opinion right now, it's definitely disrupting the meridian that's controlling your low back. And when I put that to sleep and I took it out of the circuit, your muscle got better immediately. And for this pain that you were having, the doctors tried to make you into a narcotic addict, and they gave you NSAID drugs. Which one did they give you? The drug?
They gave me Norco.
Ibuprofen?
For just now?
No.
Toradol.
Toradol, Norco,
and
Vicodin.
Vicodin, and they gave you NSAID drugs that could have torn up your stomach and really made a real problem for you. No one's looking at the cause. I'm trying to find the cause for you.
Yeah.
So I think that is a significant cause. I need to do a few more things.
Okay.
Is it going?
Yeah.
Oh, okay. Before we put that tooth to sleep, and we didn't catch me doing this. We're doing it afterwards, and I'm reenacting it.
Mm-hmm.
When I had you touch that tooth here, number 12, and I said hold, you were weak, and
Yeah.
your arm went right down, correct?
Mm-hmm.
And it not with the other teeth,
Mm-hmm.
and some other teeth had root canals, but this tooth was very weak,
Yes.
correct?
Uh-huh.
And now that I put it to sleep, hold. Okay, so all we did was we took it out of the circuit temporarily.
Mm-hmm.
All right, Mom, you would say that's accurate
Accurate.
because you saw this, correct?
Absolutely.
Okay, thank you. About 15-20 minutes since we did your tooth, and I asked you, is there any pain in your back right now?
No.
It's all gone, 100%.
Yeah.
Okay, thank you. Would you believe this, Mom?
I wouldn't have believed it.
Okay. You understand at this point, all I did was I pointed the finger at a problem tooth, and the disposition of this will be with a dentist.
Mm-hmm.
And you want to go to a biological dentist who understands these things.
Yeah.
Okay. And my dentist, Silvano Sen, tells me when I find something like this, I am better than 90% accurate. And in your case, it's going to be probably closer to 100% because of the incredible effect this had. It got rid of your pain,
Yeah.
and it made you stronger. Now, there's nothing that's 100%. I'm not. but I'm highly suspicious.
Yeah.
Both of you understand that, right?
Yes.
Okay.